So we're here today at beautiful Örenäs Castle in Scania in the most southern part of Sweden. And with us today we have Dr. Bill Salter. Welcome to Sweden.
Thank you.
You've been kind enough to join us today to discuss patient safety in radiotherapy, and especially when it's based on real-time measurements with a transmission detector. And this is, of course, quite new technology. You're a member of several task groups in the US that work with defining standards of practice for safe delivery of radiation treatments. But before we go on, please tell me a little about what do you do actually, and what is your clinical background?
Well, I'm a professor and chief of the Division of Medical Physics under the Department of Radiation Oncology at the University of Utah. So my clinical background is I have 25 years of experience in this field as a medical physicist, a PhD in medical physics, and supervising and overseeing all of the technology and processes that are used to treat patients.
Let us begin with a very simple question. What does patient safety in radiotherapy mean to you?
Well, in recent years, our technology has just continued to advance and just in quantum leaps. And that's a very good thing for our field and for our patients, but the trick is to administer that technology safely. And so safety in radiation oncology, radiation therapy, is about finding ways to use this very advanced and complex technology, but to apply it safely and to avoid errors.
And speaking of errors, what types are there in general, and how would you categorize them?
Well, there are a bunch of different ways to do that. Historically, we have what we refer to as near misses, errors that came very close to reaching the patient but got caught. There are errors that actually do reach the patient. There are a number of ways to categorize those. We have errors that are significant in clinical impact, and those are often referred to as misadministrations or medical events. Those are the worst sort. Those are the ones that have the most impact on the patient. And those are the ones that this technology that we're discussing today, I think, has the best potential to catch and prevent.
So of course, it boils down to how we can catch and prevent errors from happening.
Well, my take is that the technological advancements that have led to our ability to treat cancers that we could never treat before can also lead to safety nets and solutions that can prevent these errors. And I would submit that that's what we need to be thinking about now, is how we use this technology to catch up on the safety side to all the amazing advances we've made on the treatment side.
So closing in on the tech, how can real-time transmission detector technology help to make patients safer when receiving radiation treatment?
It's an amazing solution. It's a very thin plate of detectors that can go onto the head of the linear accelerator. The beam of radiation passes through the detector. It's virtually unaffected by passing through this detector. So the beam is not corrupted or harmed or degraded in any way. And yet there's an independent measurement going on all the time while the patient's being treated. So if something starts to go astray, we can know it and we can stop. Theoretically, the day could come where we just don't have these kind of errors anymore. And so for the very few patients who have experienced these very catastrophic errors, it could be life-changing. Not to mention, for all the other patients who don't experience errors, there is angst and anxiety that goes along with being treated by technologies that they don't understand. If we in our clinics can convey to them and help them to understand the multiple layers and the high levels of technology we've put in place to ensure their safety, I think that it's going to lead to less stress and less angst, and I think overall that's going to help with their health as well.
And how can this technology work to help us achieve this potential there is?
This technology is approaching the problem, in my opinion, for one of the first times in the right way. What we've had to do in the past, what we've done in the past, is put more human layers into the equation. And by putting enough layers, the probability of an error slipping through all of those safety nets becomes very small, and it's been very effective. But it comes at a high cost of resources and people. It's not foolproof. So I think that applying technology to address the problem that our technological advances created in the first place, all these moving parts, all this complicated treatment, which is incredibly powerful and helpful, applying that same technology to create a safety net that is bulletproof, I think is the right way to go.
But how much of this technology actually exists today?
Well, that's the exciting thing, is that these technologies do exist. We've been using some of these technologies, some of these first forays into this realm of real-time error detection in our clinic today. And it's exciting. It's evolving and it's growing, but it exists today in a form that is extremely useful. And as our testing has shown, is capable of detecting small errors real time. We're not seeing the gradients at the edge of the beam degraded. We're seeing very small attenuation on the order of 1%. So I would say that those features that are needed are, it's quite exciting to say, are existing already.
You sound very optimistic about this evolution technically.
Well, it's just really, I just got it in my hands recently, and it's really just starting, and yet it's already extremely useful. I'm sure it'll grow and it'll evolve and develop even more capabilities. I think there's potential for this kind of technology to give some of that return on investment we talked about earlier, where we can realize efficiencies and paybacks on the technology, where it streamlines and automates some of the routine QA that we do on a regular basis. But it's very exciting to think that I have something in my clinic right now that can prevent the types of errors that we've all laid awake worrying about in the night.
And so what are the biggest impediments to implementing such technology?
If you look at it, if you look at both sides of the equation and you look at the returns on investment that I alluded to earlier, and when you fully appreciate what the risks are and the costs of the risk if these errors do happen, I think that balances out nicely. We talked earlier on what my clinical background is. I'm a bit unusual in that I wear two hats at the university. I'm the division chief and professor for medical physics, but I'm also the administrator for our department. So I'm the bean counter, if you will. I'm the administrator who has to make decisions about where we spend our money and our limited resources. And I came to the conclusion that this was a smart thing to do and it was the right thing for our patients. And I think it can be justified from a financial perspective when you fully appreciate what all the risks are.
Man hours, liability insurance, reputation, even marketing. Where is it possible and where could you actually accept to save cost?
Well, there are opportunities for efficiency improvements. There are QA tests that we do on a daily basis that this type of technology can do automatically for us. And ironically, something really interesting and something that we've discovered that's very exciting is we do a daily output check at the beginning of our treatment day, and we confirm that the output of the machine is correct. And then we assume that it's good for the rest of the day, and we do it again the next morning. Devices like this can tell us throughout the day how the machine is performing, real time. And so that could lead to reductions in numbers of tests that we have to do independently, and so there's time and manpower savings there. There's also an opportunity to go to another level in our understanding of exactly how much dose we're delivering to the patient. As we invest in these technologies that make things safer, I have in my career seen an opportunity to use that as a marketing tool with patients. Patients are naturally afraid of these technologies that they don't understand. They hear the word radiation, linear accelerator. It all sounds very scary to them. I've had so many conversations with patients over the years where I sit down with them and I talk to them about all the safety processes that are in place, and it's very reassuring. And I would submit that that's a way to distinguish one's self from the competition. And so if your hospital has gone to this extra level of safety, I would submit that that's a good thing to market.
Would you expect small discrepancies in delivered doses obtained by this technology to be corrected for in the future?
That's a great question, and that's part of what I was referring to about the evolution of this technology. I mean, it's finding its way into clinics now, which is so exciting, and it's exciting that there are opportunities to figure out how to exploit it and get the most out of it. And I think that that's a possibility. I alluded to the fact that we've noticed 1% and 2% changes in the output of our LINAC throughout the day that we've always known existed. We know that that happens. It's just that it would be impractical to try and measure that for every patient and correct for it. It's a small thing, and it would take a lot of work to measure. But if, as a byproduct of implementing one of these real-time measurement approaches, if you already know what's going on, theoretically you could automatically correct for that and make your treatments even more accurate.
So, all said and done, what's your take on the future implementation of this technology and, of course, its significance?
I think the potential is enormous. I've been doing this for 25 years, and you see lots of things come and go, lots of dog and pony shows about the next latest technology, but there are very few game changers. And I would submit that this technology is one of those very few that has the potential to really change the game. And when I say the game, I'm talking about the safety game, making our treatment safer for our patients, and knowing that we can do that every day, every patient, every treatment.
Dr. Salter, or maybe I should even say Professor Salter, it's been a pleasure. Thank you so much for joining us.
It's been my pleasure.